Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Okay, doctors, what I want to talk about today is there's a lot of confusion, especially in my colleagues' market. I'm a doctor of chiropractic, and in the chiropractic market, there's a lot of confusion in the aspect of, is a chiropractic technique assessment a spinal injury assessment? And the answer is a resounding no. There are over 100 different spinal techniques. You know, if we want to look at it, we could have the activator method. I'll just name off, some that people, know and understand. Atlas orthogonal technique, Spears technique, barge technique. We could have the chiropractic biophysics technique, Logan basic technique, Merrick system technique. I could go into the network technique. I could go into NUCA technique, Nemo receptor technique, Pedibond spinal biomechanics technique, contact reflex analysis technique. There's Gonstead technique. If I didn't name your technique, please, Kale technique. There's a lot of different techniques. Not one of these techniques is a technique to assess the spine for injuries. Not one of them. Now, that's where the confusion in the documentation comes in, and that's where I think a lot of confusion comes in chiropractic. Your technique analysis is great. Your technique analysis can be used to show when you have a bodily injury to the spine, there's only three things you're going to injure. You're either going to break the bone or you're going to have connective tissue damage. The most common and most problematic connective tissue damage is called spinal support ligament damage. And that how that shows up, the bioimaging, biosensor on that is the excessive motion. And you can have disc herniation, and how that shows up on imaging is in the MRI, right? So you either there's only two tissues to a spine. The spine is made up of just two tissues, connective tissue and bone. So if you damage the spine, you either have to damage the connective tissue or the bone or both. Connective tissue is easy. Support ligament damage causes instability. It causes excessive motion. Disc damage causes disc herniation. That's it. Now, there's not one chiropractic technique analysis that actually covers that. Not one analysis looks for that. If I do an upper cervical specific technique, I may only shoot films of the upper cervical, right? Well, what if I have a T7 fracture? Or what if I have a C7 fracture and I don't even shoot the film for that? Am I not responsible for that if I'm doing an assessment on the patient? And how is that technique going to assess for that? They don't, right? So what you use your chiropractic technique for, and it's very, very valuable, I don't care what you use, is to help basically manage and improve the conditions around the injury, which is oftentimes a permanent condition, so the patient does not have to suffer a lifetime of pain and a lifetime of activity reduction as a result of these injuries. But your technique is not an injury evaluation. Far from it. So if that's caused any of you out there listening a point of confusion, I hope I can de-confuse you, because an injury analysis, standard injury analysis to the spine should be done in every office the same way, regardless of what office you go to. It's like dentistry. It should be like dentistry. If you go into a dental office, you look for a cavity, I don't care where you go. I don't care what state you go to. I don't care where you go. The assessment's pretty much the same. Saw pick on the teeth, determine if there's any softness, x-ray, correlate what you found with the x-ray with what you found in an exam, make a clinical decision. No, this doesn't need to be drilled and filled. Yes, this needed to be drilled and filled. No, this is too deep to be drilled and filled. It needs a root canal. It's very easy. Spinal injuries are the same. They're very easy. The experts out there that teach that this is so complicated, it's not complicated. As a matter of fact, it's the antithesis of complicated. And all of your documentation issues, all of the problems that you suffer from are related to the fact that once you probably are not, nor do you have a standard spinal injury assessment in your practice. Orthopedic tests are not standard injury assessments. Your neurological exams, they show the effect of injuries. They don't show the actual injury. Your techniques, none of them, no injury evaluation there. In your education, just like in my education, no standard injury evaluations. Number one problem in the market today, most expensive problem in the market today are spine injuries. And no standard injury education, no standardization of the injuries, the evaluation of the injuries in any chiropractic college, any osteopathic college, any medical school, or any school of physical therapy in the United States today. Not one example of it. So, of course, it's confusing. It's very confusing. But what I wanted to address today is if you think that your chiropractic technique evaluation is an injury evaluation, it is not. It is not. Now, it is very, very important, though, because like I said, oftentimes, if I have excessive motion due to the hyperstretching of the ligaments at C5 and C6, and I have 3.7 millimeters of back and forth motion translation, that's a bad thing to have. Matter of fact, that's a surgical level of soft tissue or connective tissue damage. Most surgical guidelines today in America have that injury as a surgical level of injury. In other words, it's pre-qualified for spinal fusion surgery. It's one of the findings that would allow for the pre-authorization in spinal fusion surgeries in general health care, right? So it's a significant condition. It's a condition that should cause one to pause and say, hey, if I got an athlete or somebody that's in contact sports, I need to reduce their activity. It should give you pause that, hey, if I have this level of that much motion, I probably should have an MRI. There's probably a disc complication. If I got a disc complication with it, then it's even a more serious condition because it requires more care. Most of the patients today that I find and I look at are probably being undertreated for this condition because it's not being analyzed properly. If we have this chronic pain situation in the United States, the majority of which is spine-related, a high percentage is spine-related. Number one cause of chronic pain and disability is the low back. Number 4 is the neck. Number 6 is headaches caused from the neck, right? So, we have this very, very high level. We have a super diagnostic problem in the United States. The majority of providers in the market today are using the terms non-specific mechanical low back pain or non-specific mechanical neck pain as the cause of, in an injury state, in a work comp state, to identify what's causing the problem in the lower back or what's causing the problem in the neck. Now, all of this results from a lack of education on the simplicity of the injuries themselves. And when you have that lack of education, you have the lack of ability to communicate in very simple terms exactly what's going on. When you can do that, it solves so many problems. It solves the problem. That standard spinal injury evaluation, not the technique evaluation, solves so many problems, solves reimbursement problems, solves referral problems, solves communication problems, solves patient understanding problems, solves problems with getting patients to get better results, solves problems with getting patients to be more compliable, solves the problem of having patients being able to relate to other patients why they should choose you over somebody else. So it's not hard. When I've done presentations to insurers before, the biggest problem that the insurers have that they don't understand is there's 100 different techniques. So you have to wade through all this technique stuff in the documentation to get to the injury and the injury evaluation. And that's the most challenging part, but it doesn't have to be challenging for you at all. As a matter of fact, if this is resonating with you at all, then what I want you to do is I want you to call us at 800-940-6513. We have the Smart Injury Doctors program. It's a very simple program that any doctor can join, become a member of. We have paid online education. We have coaching. We have marketing materials. We have all kinds of really interesting stuff. If you don't call, look us up at www.smartinjurydoctors.com. Doctors, what I do on each one of these is I just take a kind of a simple subject. And the simple subject I wanted to talk about today was your technique evaluation is not an injury evaluation of the spine. Far from it. So you can't rely on that as your injury assessment. If you're doing that, you're denying the patient access to benefits that they probably are entitled to. And it's going to cause you, your staff, your clinic, a lot of problems. And they don't need to be caused at all. So, doctors, as always, I appreciate your time, your attention that you give to me. I really do. And I try to pick up a topic. Hopefully you're listening to this going to work, or you're listening to this while you're working out, and it makes some sense. You may have thought, wow, I'm doing my standard technique, and nobody's told you your technique analysis is not an injury analysis. So, doctors, thank you for your time, your attention, and I look forward to delivering more content on the next podcast.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.